All right, welcome everyone to Chronic Disease Prevention and Management Monday meeting. Today we're going to be talking about diet and omega-3s and fish. I'm going to start the first part of this lecture with a bit of the academic side. Mom, if you go to the next slide for them.
Oh, I clicked.
Yeah, click there. You got it. Good. Good. So when we look at omega-3 supplementation in the studies, it's everywhere. Omega-3 reduces cardiovascular disease. It can help with reducing inflammation, CRP. And the reason this is so ubiquitous in the medical literature is because it is a pharmaceutical. You can give a specific dosage, 1 gram 4 times a day, and it's been shown to say lower triglycerides, which it has been proven. And this was FDA indicated for lowering hypertriglyceridemia. So that's why fish oil omega-3 is recommended, supplemented, and prescribed. Next slide. Salmon and fish, which is going to be a huge part of this lecture, has more variables to it. How fresh is it? The B vitamins, the amino acids. Yes, the omega-3 concentration in the fish, and there's a variety of omega-3 levels depending on the fish, where you catch it and when you catch it. So a lot more variables, and maybe why it's not recommended and prescribed, right? You can't prescribe fish. You can't write a prescription for fish. But there's a lot of really good reasons to consume more fish. Next slide here. We have to talk about inflammation as a root cause for depression. I got it. Inflammation as a root cause for depression. Cytokines, interleukin-6, we can measure these markers. We can get a blood test for them, and we can see if they're elevated in a person. And they're not specific markers. They can be elevated for a variety of reasons. But they have been associated, among other things, with depression. Inflammation, depression, and fatigue, they're all interrelated. And we can, again, monitor these. We can ask patients, are you feeling depressed? Are you feeling fatigued? These are more subjective measurements. And then we can measure their inflammation in the blood with CRP, IL-6, interleukin alpha. We know that a lot of COVID-19 survivors, we could see their inflammatory markers. We could monitor it during the COVID. The people with a greater cytokine response, the greater inflammatory response to COVID, they did worse. So what makes a person have less of an immune reaction to COVID? Well, their diet is a huge source of that, what they're consuming on a daily basis. Now, salmon and fish are anti-inflammatory foods. The omega-3 fatty acids in fish can help modulate, for example, prostaglandin release. So prostaglandin inhibitors, everybody knows those. Those are ibuprofen. So non-steroidal anti-inflammatory drugs, like your ibuprofen, is a prostaglandin inhibitor. Women, during their menstrual cycle, they might have a very severe, painful period. And this is from high prostaglandin release. So they take an ibuprofen. But you could potentially mitigate that high prostaglandin release by eating a better diet, higher omega-3 fish diet. And you could potentially avoid a lot of dysmenorrhea, is the medical term for a painful period, for example. Cytokines and inflammation. So according to the CDC, 1 in 9 women, or 10 to 20%, experience symptoms of postpartum depression. And this can be crying, feeling withdrawn from the baby. Most pregnant women's diets are inadequate in omega-3s due to low consumption of dietary sources of omega-3s. And we do that routine screening in women. Women who come to us for pregnancy optimization, which we do, we look at their whole nutrient panel. We look at their omega-3 to 6 ratio. We look at their vitamin status, we look at their methylation status, and we can optimize their pregnancy. As studies have shown, if you optimize the omega-3 to 6 ratio, you can even increase the IQ in the developing child. You can decrease postpartum depression rates. So this is all well known, and we can do it, and we do it pretty routinely at Iron DPC. So the key is inflammation, regulating that cytokine storm, regulating that cytokine response. We learned about the cytokine storm in COVID, and it really comes back to this, the diet. And during the pandemic, I had a lot of people unfriend me and block me on Instagram, colleagues of mine, peers that I went to school with, because I was suggesting, dare I say suggest, that you could modulate COVID death and morbidity from diet. And I was censored also by YouTube and Instagram for suggesting this, but it's true. We can modify the diet and we can have less of an inflammatory reaction to everything, and we can have less cytokines, less IL-6, less CRP in the blood that drives all these problems. Let's also touch on a bit of some other reasons potentially for depression. Low cholesterol and depression. This has been associated that low cholesterol is associated with increased suicidality from an old study. So fats are very important. Depressive individuals were found with adverse plasma lipid concentrations, so higher triglycerides and lower HDL. We all know if you eat a higher fish diet, you will have higher HDL and lower triglycerides from eating a fish diet. Triglycerides really, high triglycerides is driven from alcohol consumption, processed carbohydrates, eating out at McDonald's and stuff, a lot of bread products. Usually that drives up someone's triglycerides, plus a really sedentary lifestyle. Your body just doesn't know what to do with all this calorie from processed foods. It just sits around in your blood, and it causes cardiovascular disease, and it's linked to depression, fatty liver disease, all sorts of bad things. Metabolic profile in depression. Again, everything that we see in a diabetic. So insulin resistance, high triglycerides, high ApoB, high A1Cs, high body mass index. All this is associated with depression as well. Interesting thing, I worked in psychiatry for a time, and I was advising patients on their diet. And I got calls up from registered dietitians threatening my license, saying that I was going to give someone an eating disorder because I was suggesting that they eat a better diet. Meanwhile, I was getting people off their meds, they were feeling better, and this was apparently something you weren't supposed to do, is advise people on their diet if you're in psychiatry. I kid you not. Diabetes, insulin resistance, and depression. They're all related, right? We treat them as separate entities. You got to go to the endocrinologist for your diabetes, and you got to go to the psychiatrist for your SSRI drug. But they're driven by the same problem, and it really does come back to the diet and the exercise. Insulin resistance and depression go hand in hand. And then the gut-brain connection is something that all these conferences that we go to, A4M, every lecture we listen to, it seems to be about how the gut plays a role in Alzheimer's, the gut plays a role in autoimmune, arthritis, and depression as well. And how foods can potentially cause these diseases. I mean, I wasn't taught that food could cause disease in school. Food was completely separate from disease. You just go to the nutritionist, they're going to count your calories, you're going to lose weight. But food, as it could relate to depression, this is a big untouched subject, and you'll get ridiculed for it and say, oh, this is not evidence-based. But there's some really good mechanisms for it, and some old studies we're going to go through kind of suggest this. So this is a cool study, bread and other edible agents of mental disease. Yeah. So there are opioid-like compounds in gluten, bread products. So you can actually get addicted to bread. It works, there's a protein called gluteomorphine, and it's like a morphine-like structure that if you take someone off of gluten, they can have addictive-like withdrawals from taking away bread products. Schizophrenia and wheat consumption. So I think there was a war going on in the US, I forget which war it was, and they had a wheat deficit in the population, and that they found that the rates of schizophrenia admissions in the mental asylums went down because there was a lack of wheat production in the US. Huh. Yeah. So why this might be happening? A postmortem study of 82 schizophrenia patients found rates of stomach, small intestine, and large intestinal inflammation as impressive as respectively 50%, 88%, and 92%. The association between gastrointestinal pathologies and psychiatric disorders has been noticed perhaps as much as 2,000 years ago. So they knew this a long time ago, back in the Greek physician times, that the gut and what you eat can influence disease.
Let food be the medicine.
Yeah.
It's Hippocrates.
Blood markers of the disease have quadrupled, and this is gut permeability in the US in the past 50 years. And in a moment, I'm going to show you some of those modern blood markers, what they look like, and how we can test for that. So this is the intestinal lining, and it's only one cell line thick, unfortunately for us. When this is damaged, you have what's called leaky gut, intestinal permeability, where food particles can flow into your bloodstream. When you have this damage from the gut, from maybe antibiotic use, dysbiosis, or for example, gluten or non-celiac gluten, or celiac, definitely celiac, but non-gluten like celiac problems, you have this damage here, and so everything you eat can enter the bloodstream, and you develop more food intolerances, more food sensitivities, so you become more reactive to things. And when you keep having an immune response to foreign particles, what happens over time? Autoimmune disease. When your body constantly thinks there's a threat going on and keeps developing antibodies, the body starts attacking its own tissues, and this is how we develop our autoimmune conditions. Non-celiac wheat sensitivity is a difficult diagnosis. It can be obscure as anxiety, arthritis, tendinitis, brain fog, diarrhea, and bloating. And I learned firsthand this problem, and I had tendinitis as a professional tennis player. Let me let some people into the room here. Okay, good. Everybody's doing their job, letting people into the room. I had tendinitis as a professional tennis player in college, and I had to give up tennis for a year because I didn't understand this back then, that gluten and specifically flüssiges Brot, as they say in German, wheat beers, IPAs, those specifically were very, very bad and inflammatory. And I kind of knew, like, oh, when I drink, it hurts. When I eat bread, it hurts. But I was in my medical training, and there's no association between food and your disease. And I was like, whoa, I got to go to the orthopedic. I got to get a steroid injection. It took me a long time to figure this out, but you guys are going to be smarter than me at the end of this lecture. So this is some blood panels we can do at our practice, what we do. This is a recent young female patient who I diagnosed with this very problem, this non-celiac wheat problem. She has this gluteomorphine, right? So this is an opioid-like compound that behaves in similar pattern to morphine in the brain. And when I take away gluten from the patient, they can have an addictive craving for it. They have a withdrawal. She also has very high zonulin. When you have super high zonulin, zonulin is a protein that modulates the permeability of tight junctions between the cells. And when you have high zonulin, this is essentially, as best we can, diagnostic for leaky gut syndrome. I mean, you're not going to find this in a colonoscopy. Gastroenterologist is not going to tell you have leaky gut syndrome from looking. This is microscopic, right? But we have zonulin, and when this is super elevated, we know that the patient has a leaky gut syndrome, and we have to try to fix this. And at Iron DPC, we have various protocols to repair leaky gut syndrome. She has anti-zonulin antibodies. Zonulin acts as the gatekeeper, and when you have an anti-zonulin antibody, this is active damage. And you have anti-actin. F-actin is a smooth muscle protein that participates in the contractile belt function of the intestinal epithelial cell. It also has a structural protein which holds up the shape of the cell and controls cellular junction and complexes. So you have these antibodies essentially against your own intestine that's driving all the problems. This is their food sensitivity panel. You can see on the right hand of the screen. The patient has developed food sensitivities across the board. Peanut is extremely bad, soy is very bad, wheat, of course, corn, even egg yolks, egg whites, dairy, almond, cashew, quinoa, sorghum, pistachio, pecan, macadamia nut, barley, rye, buckwheat, etc. The list goes on and on. It seems kind of exhaustive. For now, the patient has to avoid these products to decrease their autoimmune condition. This patient has classic or clinically what's called idiopathic juvenile arthritis, where they're very young, they have arthritis, but they don't have the conventional markers of like rheumatological condition, something like that. So that's why it's called idiopathic. Idiopathic means we're idiots and we don't know why it is, but I think I know a little bit better why it's happening, right? So the conventional treatment for idiopathic juvenile arthritis, it would probably be what? Steroid injections, maybe surgery. There's a famous case, Michaela Peterson, she had that and she ended up having her ankle replaced, fully replaced because she couldn't walk on it anymore. This is a pretty serious condition if left untreated. And she ended up treating it with the Lion's diet. Lion's diet is a complete elimination of anything except basically steak. She just eats steak every day. And yeah, that's a pretty, it's like a hammer crushes the problem solution, but it can work. This patient had across the board vitamin deficiencies as well, which is driving a lot of problems such as thyroid dysfunction, hormonal problems, acne, all sorts of things. We can see here, we can test, and I can see if a patient is eating fish or not. And I can see the patient's not eating fish. This patient does not eat fish. Omega-3 index, omega-3 very low. Omega-6 very high, 35.36, so above the reference range omega-6. This patient is consuming high omega-6 diet, so they're eating seed oils, peanut oils, soybean oils, and low omega-3. So this pushes their ratio towards high inflammation. And then we also have across the board genetic mutations that predispose the patient to deficiencies, plus serum and cellular deficiencies of vitamins. Linda's waving her hand, yes?
We're still seeing the screen that says young female patient case report on gluten problem.
Okay, let me switch the screen here, that's my bad. All right, there we go, that's this one. So yeah, you can see the mutations, vitamin A mutations, B vitamin mutations, vitamin C mutations, and then serum and cellular deficiencies, and omega-3 and omega-6 imbalance, as well as K1 deficiencies too. Wheat in the brain. We talked a little bit about this. You can develop antibodies against gluten, and they can attack cerebellar proteins. So you can get brain inflammation from non-celiac gluten sensitivity, and definitely celiac problems too. So you can develop mental illness and potentially schizophrenia, other problems down the road if it's not treated and not addressed. Potentially other neurological conditions, right? If it's attacking the brain, what else could you get? You could get demyelinating syndromes. You can get, maybe you can get POTS syndromes. Maybe you can get Parkinson's syndrome. Maybe you can get epilepsy. When you have antibodies that are attacking the brain, inflammation in the brain, the neurological cascade can be quite extensive. Diet as a cure, bread and other edible agents of mental disease. I love this study here, but we're going to skip on because we need to move on here. That's more on this. Cow's milk, a little bit on cow's milk. So as we saw, this patient did have some IgG antibodies against cow protein, cow milks too. There might be some differences in the type of milk proteins you can consume, A1 and A2 milk proteins. We think also that pasteurized dairy has some problems associated with it inherently because you lack enzymes that help you digest it. There's more lactulose rather than lactose in the dairy, right? The higher you heat it, the more lactulose, which is a diarrheal agent that you get out of the dairy. And then you eliminate all the probiotics that can help heal the gut. And so, this patient should probably avoid all milk proteins for the time being, and eventually maybe getting on some raw kefir to help regenerate the probiotics. Omega-3 to omega-6 imbalance. We just saw this illustrated in a patient, omega-3 to 6 imbalance. We can look here at the high omega-6 and the omega-3 ratio of a variety of plant proteins, foods if you call them, or oils. The problem is they're super high. Sesame oil has about 41,000 milligrams of omega-6 to only 300 milligrams of omega-3. So it's very difficult to balance your omega-3 to 6 ratio to modulate inflammatory cytokine responses when you're consuming peanut oil, sesame oil, seed oils, corn oil, soybean oil, grapeseed oil. You can probably take some fish oil, omega-3s, but you'd have to supplement with a lot of omega-3s to try to balance this. So the best would probably be take omega-3, eat fish, and avoid the omega-6s too. Don't cook with seed oils if you don't want to have problems. Exercise, we all know about exercise to treat mental health disorders. That's not the purpose of this lecture. Exercise does reduce depression and inflammation. Intensity matters. That's why I try to get all my patients to exercise here. Vitamin D is important. Again, vitamin D is in Spanish mackerel. It's in certain fish. So vitamin D, we all know, is very important for mental health and preventing all sorts of diseases. Mom's going to take it away from here for her part of the lecture because she has experimented a lot with her brain and fish. So Mom, take it away.
Yes. So listening to everything Stefan said there, I believe that most Americans are eating a 16-to-1 heavy omega-6 diet.
Yes.
They're just walking around sad and they're looking for ways to feel happy. The brain should feel content to euphoric all the time, and nobody's getting that. Nobody's getting that.
No.
Let's move to the next one. Okay, so I'm not going to go over the science except to say the brain is made up. The good parts of the brain are mostly made of omega-3, and you can obtain a bit from the diet, but when you go through birth and you produce an entire human in you and you nurse, that little bit goes away. And I'm surprised any women don't feel sad after giving birth with the American diet. Okay, next. Okay, so we were macrobiotic back when I gave birth. And that seemed fine, giving birth to Stefan. But by the time I had the second child, I must have run out of my B vitamins and my omega-3, and I was sad. And so we were looking for different ways to have different health food diets. I did an anti-inflammation diet where you eat a lot of almonds. Almonds are high in omega-6, so forget that anti-inflammation diet. We did the Garrison diet where you eat tons of bananas. That does kind of make you high on carbs for a little bit, but then you feel sad later because of the inflammation from the carbs. So, Garrison, no. We did a lot of juicing. Unfortunately, you put apples in there. Once again, it's too sweet. The vitamins are great, but too sweet.
Yeah.
And of course, no omega-3s. Now, all that time, I knew to take some fish oil pills, and we had them in the fridge, and I took them. Have you ever taken a fish oil pill and it makes you burpy? That means the omega-3 got degraded, which is so easy for it to get degraded. We found out when we bought Spanish mackerel that they sell it to people to turn into oil, so they don't put any ice on it. And I would go and I'd buy it, and they'd look like me that I was crazy that I wanted the Spanish mackerel. They're like, "Oh, it's gamey. That's a bony fish." They have their little complaints. But the fish was already been on the boat all day hot. And I buy it, and this is one of the reasons at 2013 we didn't continue with the Spanish mackerel diet. Very hard to get it fresh. So, okay, what was I doing in 2013? 2013, we were eating a lot of grass-fed beef. I think some of it was frozen. Now, a big thing we learned, already knew, but learned again from our Italian functional medicine doctor is that omega-3 is fragile. It can't stand up to the freezing process. So if you eat the grass-fed beef that was frozen, it's probably, maybe some survived the freezing process, but it's probably degraded, and it's even worse than if you had no omega-3. So we were at a tennis event, and I had been eating in the car, I'll never forget, grass-fed beef and cabbage, because I did find that cutting back on carbs made me feel better. But I was watching the tennis event and felt anguish bubbling out of my intestines. I put that in my food diary. I Googled that, and I found there was one Irish poet who used that term. And I was like, that is crazy. I have a wonderful life. Why is anguish bubbling out of my intestines? And the next day, I think Thomas caught Spanish mackerel. We ate it, and I was ready to start the Spanish mackerel religion. I bought a necklace, a Spanish mackerel necklace. I felt wonderful the day after. And we were very excited by that, so we started eating as much Spanish mackerel as we could get. So I would go up and buy it from the place that was selling it for the fish oil, and Thomas would catch some. And then in the summer, we were able to get the wild-caught wild-caught salmon. So by the end of the summer, it was hard that the salmon ran out. It was hard to get Spanish mackerel, and we thought, oh, maybe I'm topped up on it. I'm topped up on omega-3. We just went back to eating grass-fed beef and things. So my mood was up and down, and I did eat a lot of fish. Well, cut to my current experience. So stopped about 2 years ago. I used to drink alcohol in the afternoon to feel a very pleasant, relaxed feeling. That's what most people need. They need dopamine, and they need to feel good. And the omega-6 diet we're on with all the carbs leaves you in this agitated state. So you drink alcohol, and I have found that my Spanish mackerel diet is as if I'm on the first shot of alcohol all the time. The brain is just so content, and I'm even euphoric a lot of the time. It's wonderful. I have no need whatsoever for alcohol. I know some people are highly, highly addicted to it, but it would be amazing to think of what people might be able to do if they could stick to a fresh fish diet. So we were at, so for a long time I was eating fish and feeling good, and I cut way, way back on carb, but I was really hungry because I'm not that interested in eating that much fish. Stefan has told me I need 300 gram a day in order to grow muscle. So I would eat my 300 gram, and then I would eat peanut butter. And I ate quite a bit of peanut butter because I was eating hardly any carb. And it didn't sit quite right in my stomach. And then I noticed this horrible yellow ring around my eyes. I asked Stefan, he goes, oh, that's Arctis senilis. I'm like, what? And I thought to myself, oh, I think that's the peanut butter. And then Stefan did a blood test on me and said he'd never seen such a bad ApoB. And I was like, it's the peanut butter. And I didn't know what to do. And then finally Stefan said to me, well, Brian Johnson, the elf, he sells a substitute that's all omega-9, like olive oil, macadamia nut, and higher than the 3 omega-6 walnuts. Now, they got to be fresh. You know how walnuts get bitter easily? Mm-hmm. You've all tried walnuts and spit them out. That's because what? Omega-3 is fragile. So you've got to get it fresh, and then don't eat bitter walnuts. All you're doing is eating omega-3 that's gone bad. Brian Johnson sells it in really small amounts because he's trying to keep it very fresh. So I switched to the heavy, my first time in my life, an extremely heavy omega-3 diet with very little omega-6. And it's just been fabulous. So, so let's see. I guess I'll go to this and then the next one, the benefits. Where's the one we're talking about with the patients? Try that. Go one forward. And forward again. Yeah. So what might happen to your patients if they try that? The brain, you know, how the brain feels is the most important thing. And I was feeling absolutely very, very good. Like, had my little coffee time in the morning with my raw dairy, and then ate 300 grams of the fish. I was feeling like euphoria, fabulous. And it didn't end then when I had the banana raw dairy and macadamia walnut snack. It didn't end, it just went on and on. So, but I think my body was kind of shocked by this change. I needed to nap a lot the first couple days. And when I slept at night, it felt like I slept too deeply, so it was too much progesterone. And my period wanted to start. Suddenly I was all sensitive to my estradiol. So I talked to Stefan, and I just cut everything in half. So that started to get better, more used to it. I found I couldn't take all my morning vitamins. It was making me nauseous. I thought, oh, you know, I need some liver. The liver made me nauseous. Everything was more sensitive. I was more sensitive to the vitamins. I was more sensitive to all the vitamins in the liver. I was more sensitive to my hormone replacement therapy, and I suddenly had no trouble maintaining my weight. Eating the same amount of food that I was eating before when I was on the high peanut butter diet, I can now, I don't have to stuff in food late at night. I didn't like doing that. So my gut is more sensitive to the nutrients, and no trouble. I don't have to overeat, and I look at the scale in the morning and I'm 111 pounds. No problem. Oh, I say here I didn't cut the nandrolone in half. I love nandrolone.
Mom loves nandrolone.
I love nandrolone brain. Let's see. Yeah, okay. So back one.
Okay.
So you go back one.
I went back 2.
So,
you want to talk about don't eating out?
Yeah. So my sister came to town saying, "Oh, let's go to Epcot." I said, "Okay." And I was just feeling so euphoric. I thought, "No, I can eat out at Epcot for a day." No, don't do that. We ate quite a bit at Epcot that day, and the food just tasted overly salty to me. You know, it really wasn't enjoyable, and I was off for 3 days, and the mood was down. So this idea that you can just take a fish oil pill supplement and you're going to be euphoric, we would know that already if it worked. We would have figured that out.
Right.
But what I'm finding is that we probably should just be eating fish. And if you go have MSG and inflammatory foods, that little omega-3 is overwhelmed. And those receptors, the body is... It'll take about 3 days to get it back. But I'm very stubborn. I got it back. And then we had to go 2 other times to Disney because, you know, you buy a 3-pack of tickets. And I tried to bring my own food then and eat less, but even a little would then still throw me off for 2 days. So I know it's hard, but man, it's worth it. Stick with it. Don't fall backwards.
I mean, what you're describing is extreme precision medicine. And I get in an argument with my colleagues sometimes. They're like, "Why? What you do isn't evidence-based." I'm like, I mean, it's evidence to you.
It's me.
You are the evidence here, and you're telling yourself you know exactly what's going on. I mean, we can't replicate this in a study. It's impossible.
Yeah. And there may be other people who do well on one omega-3 pill and the rest of the day eat at Disney. It could be. It could be. That's not me. So go forward and then forward.
Benefits, we talked about nandrolone.
And so, So if you have a patient who's as stubborn as I am, and they can just eat fish and keep that 3 higher than 6, and of course keep carbs low, keep the carbs under 50, to 100, keep them low a day, they may find quite an experience with it. That's fine. And just let them nap a little, let them have an experience, let them cut out the things they used to have that made them nauseous. The body it's a huge thing. Who is doing this? I guess there's some people who eat lots of fish. Okay, so now after it's been about 8-9 weeks now, I have started to up my HRT again. Although I did up the testosterone and it felt a little gurgly, so I don't know. I'm still working on it. I am taking some of my water-soluble vitamins again. I need the magnesium and potassium. And I really don't have any problem with that. So I take so many. The other is I'm adding them back in. I had cut back half of the NP thyroid because I was napping. I think I needed the napping, and now I'm fully back on the 60, and I'm not napping anymore. That really only lasted, I don't know, off and on the first 2 weeks. I still have no trouble maintaining my weight. Love that. Also sometimes I'll eat a couple of our eggs. We have free-range chickens. We feed them all the scraps from the fish we fillet. They eat the eyeballs. We get the lutein. They eat all the guts.
Yeah.
They love it so much. So their eggs, the eggs at Publix say they're high in omega-3.
Yeah.
And then but they're vegetarian.
As a rule of thumb, chickens are high omega-6 animals because they're fed seed oils.
Fed seed oils, yeah. But ours get a lot of fish. So that's good. I don't focus on eating the eggs. They only give us 5 eggs a day, but those are high in omega-3. Okay, next. Okay, so now this is important. Why would your patients ever stray from a high omega-3 diet? Why did I? I'm extremely stubborn and like to find things that work. Well, oily fish is difficult to obtain. The best is Spanish mackerel. Googled, everybody knows that. The next best is kingfish. I guess it's high in mercury. I've never noticed. I go in the sauna every night. But the Spanish just has the most oil. King is very good. It also gives me euphoria. Now, the fish has to be wild caught and never frozen. When you know, it's tough with these fishmongers. I've had to deal with a lot of fishmongers. You'll find out later, like, oh, well, everything's been frozen here. Like Dijon's. It's all been frozen. Had to find that out. I know I've had bad experience with clams and mussels that I also eat. Yeah, that's hard to keep them fresh, even though the things are alive.
Make sure you can see the eyes are dark and clear.
Okay, so when you find a good fishmonger, they're never perfect, you want it not filleted. I mean, you're taking your chances if it's filleted. You want to be able to look that fish in the eye and see the eyes are black and clear, not rusty looking and spotted and yellow. And the gills should be shiny and the scales should look good. You get used to that. The other day I went to the fishmongers and their ice machine was broken and he already packed up the fish before he told me. I didn't want to insult him and get banned, but I shouldn't have taken it home. How was he keeping it cold? I noticed that there wasn't that much ice. Dealing with fishmongers, it's a whole thing. Let's talk about the fish oil supplements. I know in the studies they're getting results. Yeah. Probably some of the omega-3 makes it through the process, yeah, but
it does.
If you Google for pictures of the processing of, there's videos on it, of fish oil pills, you'll see Asian people in short sleeves. It's not a cold, they're not keeping, and they're putting a bunch of fish in a pot. Oh, and then they bleach it at a hot temperature. They heat it up a couple times. I don't see how they've even done the studies of with the fish oil pills. But I guess some omega-3 did make it through. Because if people had been euphoric on the fish oil pills, well, we know that already.
It makes some difference for sure.
Yeah, there must still be some in there.
I mean, it's better than not eating any omega-3.
Yeah, and when you eat it, if you can't get the oily fish, then you've got to get tuna or swordfish or flounder. Delicious, very easy to eat because they only have 1/3 the omega-3. So you really got to keep that omega-6 down to have more. If you're eating just non-oily fish, boy, you can't stop and take a chip, nothing, or else boom, you're going to be higher omega-6 and throw it all off. Okay, next. All right, so I'm older and the digestive, the stomach acid just goes down as you get older. So don't drink a bunch of water before you're going to eat. Half an hour. Don't drink during the meal. You want to get this valuable omega-3 in there, and then I take a digestive enzyme, and then I don't eat anything for 2 hours after I've eaten my first 200 grams because I want it to work bad. So omega-3 is fragile. Cut the fish into small pieces and go ahead and put a little water in there to simmer. And you just, if you have thick pieces of fish, it takes longer to cook through. Cut them till you have little strips, not more than a quarter thick. Put them in for 1 minute with a lid. Turn them over, 1 minute. Break them up with a spatula. The second it's not purple, it's out. Don't overcook it because you're just destroying more of the omega-3. This method works. I know I'm getting my omega-3. After it's cooked, I just put on a little sea salt and high-grade olive oil. You know, it's just omega-9, so there's no 6 in there whatsoever. I usually have it with some raw red bell pepper because I want the A and the C because the fish doesn't have those vitamins. Other vegetables are also nice, especially with the oily fish, moves things along, helps with digesting. Yeah, so I personally cannot eat 300 grams of fish at a time. And I don't want to. I'd rather have a cinnamon roll. So I start with the fish. I keep telling my daughter that because as she's eating, you know, something that's not as healthy. I'm like, I don't particularly want to eat fish, but it's fabulous. So I make my 200 grams of fish and I eat it. And then later I have the last 100 to get up to 300. I can't get 300 in at the same time. Yeah.
And you cook it very lightly. That's the key.
Cook lightly because if, well, we'll get to that. We'll get to that with all the no's.
Okay.
All right. For your patients, No, you have to be tough with them. And they have to look themselves in the mirror and look at themselves and say, no, you cannot eat in restaurants. Sushi, sushi has all been frozen by law. So the omega-3 maybe made it through, probably not. I've never noticed a thing after eating sushi. It's not full of omega-3. Also, let's say that the restaurant does have fresh fish. There is no way in heck they're going to prepare the fish as you would, in a delicate way. They're going to put it on the grill. It's going to come with those grill marks. Mm-hmm. They're going to put some weird
soybean
salt
oil.
on it.
They put
and soybean oil.
Yeah.
It won't feel right.
Yeah, I was at Bonefish Grill, and they said the fish comes sautéed in oil on the grill. I'm like, what oil? Well, we don't know. We'll find out. Because they said it's an olive oil. It wasn't an olive oil. It was a soybean oil mixed with an olive oil.
And it's amazing how this can throw you off. You're thinking, but it's still fish. I've tried it. It's really good if you can ever get them to. Of course, I guess some people might get something out of that restaurant fish. So everybody says salmon's healthy. Oh, we have no's here. We have caveats. You cannot eat wild-caught salmon all year. It's just summer. All right? All these people like, it's fresh frozen. Okay, maybe their freezing process is so delicate. You get something, it's nothing like if you can get it fresh. And I'm going to check with Publix. That better not have been frozen at any time. I mean, I noticed the Spanish mackerel has such more of a kick than the salmon, but the salmon is so delicious. So, okay. Now, farmed salmon. I cannot believe at Publix standing there ordering my wild-caught salmon and the old people come in and they point at the farmed and they want that. And I say, there's wild caught. And they look at me like there's something wrong with me. So there's no omega-3 in farmed salmon. These are, this is salmon raised in the ocean. The only part of being in the ocean is that it's wet. They raise them in these pens so that they don't have to clean the pens. There's a little water going by, taking poop away. What do they feed them? Rapeseed oil.
And how do you know this?
Well, I was at Publix and he told me farm salmon is raised in the ocean. It's as good as wild. So I called Scotland.
She called Scotland.
He answered on the first ring. He has nothing to do. And I talked to the Scottish guy, wild accent. He said, we feed him rapeseed oil. He fed some rapeseed oil. And I said, now how do you get that red color? He goes, you have to feed him red food dye. He told me everything you want to know. Don't eat that stuff. They feed them red. And I was the one who called Publix and said, you put on there, it's got red food dye in it. And they have a little disclaimer on there. It doesn't stop people from buying it. It has a squishy, greasy taste to it that people like more than the lean wild caught. So, smoked salmon is so fancy. Fancy people eat smoked salmon. No. Omega-3 is fragile. It's not going to survive the warming and aging and smoking process. Okay, next. There's more no's. No, do not smoke your fish. Don't grill it.
No browning.
Don't you brown it. I don't want to see any brown marks on there. I don't want to smell delicious onions being fried in some oil. Don't freeze it. Don't turn it into a dip. And don't simmer it too long. Really, you break it up small, and the second you see no more purple, it's out. And no, you can't soak the poor fish in acid to make a ceviche. What's it called?
Ceviche.
Because?
Why?
Omega-3 is fragile. Acid?
There you go.
You all know what acid is. So, can you buy canned sardines and herrings? Well, probably not, because for one thing, they don't put ice on those cheap fish. They're going to be so hot for so long before they're finally canned. Omega-3 is fragile. Can it survive the canning process? I've never noticed anything. I bought a bunch of sardines in case of Armageddon, and they just sit like a rock in my stomach, the canned sardines. I don't think so.
It's protein, at least.
Also, yeah, that's true. You could survive on it probably for a while. Sad, but survived. That's the American diet. Sad, but we're surviving. Now, the FDA, I bought some herring, I think it was, that said no salt in it. And this is so sad. The FDA says that trisodium phosphate, the industrial cleaner that I use to clean my fireplace, is grass, generally recognized as safe. Nobody on the planet recognizes it as safe except our friends at the FDA. So I have been poisoned by cod that was heavily treated with a TSP, and the fishmonger said, he wasn't supposed to put TSP on it. And then I bought cod at a bunch of other places. They were all poisoned. I have all the samples in my freezer. I've made a formal complaint to the FDA. They have not responded. I'm always bothering them on Twitter. They don't care.
They don't care.
So if the fish tastes at all salty, it was treated with a TSP. Now they're only going to do that on the cheaper fish, or they won't do it on the mackerel because I buy the whole mackerel. They can only do it if it's been filleted, because the TSP, as you can imagine, rips open the protein so it absorbs disgusting TSP water. And then as you cook the cod, this gross water comes out and it tastes briny. Yuck. We've got to get them to change that. So already talked about the omega-3. Okay, next. Okay, so what older people need is protein. I suppose everybody needs protein. Now, when I ate a lot of grass-fed beef, and sometimes I do, I chew and chew and chew. It does not turn to liquid in my mouth. I don't see how my guts are going to turn it into liquid. So I've never read anything about this, but probably because fish is tender, especially when you cook it lightly, it's going to digest easier if you chew it than grass-fed beef. Also, the grass-fed beef just kind of sits heavier in my stomach. The fish is so light. You're feeling you're digesting it, and then you're getting that protein you need too. So it's not just the omega-3. Also, what you don't have in those fish oil pills that have been bleached, there's nice things that Stefan mentioned, like vitamin D and selenium in the fish itself. So you're getting all the protein, you're getting the omega-3, you're getting lots of other vitamins too. So yeah. Oh, also you get the skin. With the Spanish mackerel and the kingfish, the skin is tender, it's yummy, it's got olive oil and salt on it, so you get the collagen you need to. Next.
Yeah, that's a good point. I mean, taking a digestive enzyme is critical, I think, especially with older age. But I have younger patients, they don't take a digestive enzyme and they eat beef, they're going to get acne. I think a lot of people need digestive enzymes. And you can do a gut microbiome test, and sometimes you can see if someone's low in digestive enzymes. I was one of those. That's what my gut test showed. So that's why I take one, and that's why I got a lot of other people onto it too.
I only take it with my first 200 grams of fish. Later, when I eat the 100, I don't take it. I don't know. I just, that's the way I do it. I guess I don't want to overdo it or become dependent on digestive enzyme. Who knows? Now, the question is this a fad diet? Because I've been macrobiotic, I've done the Gerson diet, I've done anti-inflammation diet, I've done juicing diet, I've done a lot of things. Well, I will keep an open mind because I have a history. But I am circling back to this since 2013. And since 2013, I've eaten mackerel every chance we could get it. It's just right now, since A4M 8 weeks ago, I am driving wherever I need to go to get it. I've been driving to Titusville, which is a hard hour to get the oily fish. Or I've eaten the swordfish or the tuna or flounder. It's just, yeah, you just get more oomph with the oily fish. Get more euphoria. So note, we all need to get active politically so that the NOAA quits selling the rights to fish our waters to the Chinese. Our waters out here are empty, and you can see the Chinese boats out on the horizon. Somebody, in my opinion, at the NOAA is getting paid off handsomely. They got to have their big staffed home in the Hamptons, and they are giving the Chinese the right to fish our waters. So between that and poisoning us with TSP, the government needs to be straightened out, as usual.
As usual. Nothing new there.
Okay, so what, a huge part of aging probably is, although we don't know exactly what aging is, probably tons of it is inflammaging. And curtailing inflammaging is probably super good for the brain. And Stefan says there was lots of studies showing that it cuts down on inflammation.
Yes.
But when you're older and that inflammation is getting out of control, you need to just cut down on it. It's got to go because I want to live a long, long, long time. So Italians would always joke, mangia pesce, when a tennis player did something stupid. Older people are at risk for losing brain matter. They just do. They lose focus and memory. And it could be that a real, not fake, but a real high omega-3 low carb diet can help. I like to show off my super memory skills. I got started doing that recently when they were saying, oh, COVID has made everybody have brain fog, blah, blah, and older people, they can't remember things. So I've been showing off things like pi to 70 digits, the periodic table in any order, that sort of thing. I can memorize stuff just fine.
You can. It's on YouTube, right?
Oh yeah, my Twitter.
Twitter?
Yeah, go check out my Twitter at Izzers Tennis. I'm now doing faces and names since I've never really done that before, and I'm starting to become quite good at it.
Wow.
Let's see. Oh yeah. I obtain much better brain relaxation and brain euphoria results than I ever got from ingesting alcohol. I mean, that's why people are doing it. I also think that's why people eat the carb. It gives you such a good feeling of dopamine for a half an hour, and people need that. The Gerson high potassium and banana diet, you'd only feel high on those bananas for a short period of time. That wasn't worth it. And the grass-fed beef, it's okay. Probably back when I was really suffering in 2013, I was also eating too much carb. So that poor grass-fed beef just did not have a chance to overcome the other inflammatory things I was doing. So it could be, I don't know, it could be that unhealthy compulsive behavior is our brain's way of trying to achieve the effects of an omega-3 low omega-6 low-carb diet.
Yeah. Conclusions. Diet is an under-recognized variable in mental health. Salmon, lug, caught fish provide essential micronutrients, vitamins, and omega-3 that provide improvements in mental health. And then diet can produce measurable changes in mental health parameters through cytokine and inflammatory marker measurements. This is objective measurements. You can see insulin resistance and mental health disorders are inextricably interlinked. Exercise is a well-known modality to improve mental health. Inflammation in diet can come from a variety of sources like seed oils, gluten, some dairy sources, and then of course alcohol, junk food, and so forth.
So with the inflammation, let me repeat again. As we get older, we have more inflammation, and we women especially, we famously don't have as many hormones. We're able to insult our body more before menopause, and we might have bad moods, but we kind of muddle along. So taking the hormone replacement therapy seems to help us combat the inflammation better. But if you really, really tamp down on that inflammation, you might need to, it's fine, work with your patients. You might need to back off a little on the hormones, and then as they get used to it, work it back in. Does that make more work for you? Yes, but it's totally worth it. If they're not having inflammation, they might not need that huge dose of testosterone.
Yeah, it's true. I mean, the hormones, they do modulate the inflammation. They help regenerate tissue. They help with pain. They help with mood. They help with inflammation. And that's probably why younger individuals, they can get away with junk food. They can drink harder. That's why when 21-year-olds, they can drink harder, they can go party, and they can feel relatively okay. I mean, it catches up to some, and they suffer the consequences like our previous patient. But it definitely affects you when the hormones take a hit, and women get hit harder than men. There's no doubt about it. The estrogen, progesterone, it's gone postmenopausally. Men can get away with some testosterone only, and they feel just fine. But it hits women harder.
Well, we have, isn't it something on top of the kidneys that makes hormones?
Yeah, the adrenals. Yeah.
Yeah. So if you can just, okay,
you can live off of adrenaline and cortisone from the adrenals. Yeah.
Well, if you're over age 30, if you could just keep the inflammation down, and then, like really over age 50, keep the inflammation down you'll still be able to sleep and do better. It's a give and take, but I think you're just beating your head against a wall, eating at Epcot all of this inflammatory food, and then hoping that you can still sleep at night from a high dose of progesterone. It would be better to do it all together.
It would, ideally. All right, do we have any questions from the crowd before we close it out here, Go Sleep? We'll take maybe one or two questions.
Who's going to try it?
Logan says, I've noticed I need to nap too on the heavy fish diet. I haven't been able to get mackerel. Okay.
You get fish or something.
Very good.
It'll soon be wild-caught salmon season.
Someone asked, what micronutrient test did you run? This is the Vibrant Nutri-Eval, NutriPro actually. NutriPro looks at your nutrigenomics, so your methylation, your genetics beyond just methylation, looks at your vitamin D mutations, vitamin K1 mutations. And then it also looks at the serum, which is what is in your blood at the time of testing, and your white blood cells, so cellular analysis, which is a 30 to 60 day average of your nutritional status. It's a top end test. I love running it on people who can afford it.
And Logan, you can get probably get King at Thrifty, and just get the lower half of the fish, not the head, because the head doesn't have any meat on it, and fillet it. And they'll fillet it there for you too.
Oh, are there any decent omega-3 supplements? I know this is Sylvan. I know there's the prescription DHA, but which is one thing, but any fish oils, that supplements that you would consider.
I would guess that if you could keep the sixes way low, then a good yes, but a good fish oil supplement is it might break through. It might be quite good. But the moment you get higher 6, then whatever's in that pill, that's rough. It's inflammation then. So what else will they eat? Well, if they're real careful with that grass-fed beef and not broiling it and not eating it frozen, they'll get they'll still be on the better 6 to 3 side, right?
Right. Okay. Thank you.
I've got a sardine-related question for you.
Okay, what about sardines? Yeah, you got.
So I know you've advocated for them during your tennis matches. I've always enjoyed them. I like them. I've got a pretty good stockpile. What was the concern? It was something about TSP.
One thing, if you look at 2 things, if you look at YouTube videos, they don't keep everything ice cold. They actually heat up the fish to bleach the oil and to extract the oils. I'm not sure that if fragile omega-3 can make it. If you eat it and you feel a lift, you've got the other 6s down, then there's still some omega-3 in there. Then the second thing is only get the unsalted, take a bite. It should have no salty taste. I made a complaint to the company. It was all salty. They're unsalted herring, and they were like, "Do you want your money back?" they didn't want to discuss it because the FDA lets him do it. So be your own guard there.
All right.
Great, very good, guys. Thanks for joining. We'll catch you on the next one. We have these every Monday night if you're interested in various academic lectures, and thanks for tuning in.